So the study is about the combined effectiveness of surge faradism and the DAFRA protocol on improving finger flexion and extension in a subject with pan-brachial plexus injury who has undergone multiple nerve transfers. So this was a case study I presented at Karnataka PhysioCon 2025, an international physiotherapy conference, Bangalore, April 25th, 2025. My keywords I have used is surge faradism, DAFRA protocol, nerve transfer, brachial plexus injury. So the coming to the background, the only option for a brachial plexus injury where all the nerve roots are avulsed is a multiple nerve transfer done at simultaneously at the early stage within 3 months will give an excellent result, followed by donor activated focus rehabilitation approach. So this combination gives a good recovery, and my earlier studies have proved that it get good improvement for shoulder and elbow muscles, but it was not got any literature on improving finger extension. So there was limited resources available for the same. So objective of my study was to combine the surgery faradism and the DAFRA protocol on finger flexion and extension in a subject with the pan-brachial plexus injury who has undergone multiple nerve transfer. So DAFRA protocol means donor activated focus rehabilitation approach. The original DAFRA protocol was having early, mid, late stages. In my modified DAFRA protocol, I have divided into 7 stages. So the patient was a 27-year-old male with a right brachial plexus injury due to an RTA and was operated multiple nerve transfer 4 years ago. All muscles in the right upper limb were grade 0 prior to surgery. The subject has undergone multiple nerve transfer. One is spinal accessory nerve, it supplies trapezius that is transferred to suprascapular to improve the supraspinatus and infraspinatus muscle. The phrenic nerve, the breathing nerve to diaphragm, is being transferred to posterior division of lower trunk to get expected recovery of the triceps and the finger and elbow finger extension and the thumb extension. Then opposite side spinal nerve, C7 spinal nerve is transferred to the musculocutaneous nerve and to the lower lung where we can expect recovery of the finger and wrist flexion. This surgery was done at Sushrutha Institute of Plastic Surgery, Elite Hospital, Thrissur, Kerala by Dr. Pradeep sir and his team. The patient was recovered his shoulder and elbow muscles to grade 4, and subject was undergone arthrodesis for wrist a year ago. Now, as we can see in this video, patient can flex his finger, but there is limited extension available and all shoulder elbow muscles improved. So here we are giving the DAFRA protocol, the donor activated exercise. The donor was opposite side nerve where we are doing 7 different actions. It is seen that when we do 7 different actions, you can see the finger starts moving. So what are the 7 different actions are flexion, extension of a flexed arm, then a close grip, close grasp, internal rotation, then elbow extension, finger flexion, wrist and finger flexion, then pronation and horizontal erection. When you do all that exercise, you can see here the finger starts flexing. Now, how did I give the treatment? Is I gave surge faradism along with the DAFRA exercise were given to finger flexors and extensors alternatively. I gave this treatment twice a day for 3 months. So how did I give for finger flexion is I put the patient in sitting position and gave Faraday current to the flexor aspect of the forearm, surge faradism with half surge and maximum rest period. I put the inactive electrode in the medial contact, active electrode in the muscle bulb. So when the current comes, the patient will do voluntary finger flexion and also the opposite side actions. So this is how I did for the finger flexors. Now you can see for a finger extension, I put in the mid-prone position to make it a little bit gravity eliminated position. Then I give the surge faradism on the back of the forearm. And when the current comes, the patient will do finger extension and also thumb extension along with the deep breathing. So he will breathe and try to do the finger extension. So you can watch now here. When the moment the current comes, he will extend. When the current goes, he flex. Again, current goes here. When current comes, he will extend like that. Now, this is about the DAFRA protocol. Earlier DAFRA protocol developed by Khan et al. It was having early stage, mid stage, and late stage. The modified DAFRA protocol, which I presented in WCPT 2021, it is basically the donor muscle strengthening with the recipient passive range of motion. So initially, when I strengthen donor muscles, recipient muscles is passive range of motion. Then in the stage 2, passive range of motion change to active assisted range of motion. Then later again active range of motion, then recipient resisted exercise. By stage 5, I try to isolate the recipient muscle active range of motion, then recipient muscle resisted exercise, then finally to functional training. So initially you can see here donor strengthening. If donor muscles are strengthened simultaneously, along with that, I try to do the passing movements along with that. Now, the result was after 3 months of the treatment, the patient was able to flex and extend his fingers more voluntarily. The range of motion was improved significantly for MCP, PAP, and DAP joint. Patient was able to extend his finger better than before. So this is the first study reported in India to get this much finger extension, probably in the world the second one. The previous study what has shown that the patients were able to get finger extension, but they were not able to isolate it from the breathing. Whenever they breathe, they get extension like that. So this is the first study which was able to isolate to get a finger extension. Also, elbow extension we already isolated long ago. Now you can see the results here. In the left side, you can see when the patient tried to bend his left side, the right side also bends. So like this, I was giving the outcome was patient was able to flex more with this treatment. So we can have a closer look here. Now, when you see here isolated, you can see he can extend also, bend also, he can extend also. So the conclusion is combined training program of the faradism and the faradism and the DAFRA protocol establish new motor patterns and foster cortical reorganization and promotes early recovery than expected. Central connections between the recipient area and the donor area get connected each other by this nerve transfer and produce neuroplasticity in the cortex. So initially the same center will control both the recipient area and donor motor area, but later with neuroplasticity because of our continuous training, we are able to create a new center in the brain. So that will control separately both donor and recipient separately. So the structure program training delivers successful rehabilitation outcome on post-nerve transfer earlier than expected. So the clinical relevance is such faradism along with DAFRA protocol improves finger extension in subject with pan-brachial plexus injury who has undergone multiple nerve transfer. So these are the references. The Khan et al. Has developed the DAFRA, which improves outcome in nerve transfer. And finally, I got the first prize in the paper presentation in the clinical category. Thank you.